Hi, I'm Jim Treat. I'm a pediatric dermatologist and here to review some of the highlights of therapy for acne vulgaris. Acne is a really common problem and one that's really important to help teenagers and other people with acne through. It's one of those diseases that doesn't get mentioned in the same sentence as heart disease and lung disease because it's not medically dangerous to most people, but it is socially really important to be able to give people the options to be able to make their skin look better so that they can feel more socially confident. And in teenagers, that matters a ton and can really help them with the rest of their social development. So in terms of acne, I think it's most important just to go through a few very practical tips. So topical retinoids such as adapalene and tretinoin are really the mainstay of acne therapy. They target blackheads and whiteheads, and if you can get rid of blackheads and whiteheads, you can really make people have acne prevented for the future and then not get all the other inflammatory acne that happens on top of it. Washcloths and loofahs and other mechanisms for scrubbing the skin tend to disrupt the top of the follicle and lead to more acne, and because of that they should be stopped when you start acne therapy. You want to not scrub or pick your acne. Picking and popping can lead to more acne around it. When you use acne medicine, a pea size will cover the entire face. What teenagers want to do is they want to wake up tomorrow morning with no acne, so they'll smear their face with tons of medicine, and that tends to be counterproductive and lead to a lot more dryness. You also want to stop thick, greasy moisturizers or hair ointments because they can lead to more acne if they get onto the forehead especially. And then medications take 6 to 8 weeks to work, which is a really long time for a teenager to wait or a child to wait of any age. And the reality is that because they take a long time to work, the compliance rate is much lower than with other medicines. But if you can really help people to use them consistently, they work extremely well. They just have to be used. Tretinoin works better for blackheads and whiteheads, and benzoyl peroxide works well for papules and pustules. And so looking at the type of acne that you have can help you determine which medication to start with, although most patients end up needing to be on both medications. And then if there is too much drying, you can use a facial moisturizer in order to help people not get more dry. So this is a freely available slide from the American Academy of Pediatrics from Eichenfeld et al., which basically showed how to use topical and oral antibiotics in people depending on what type of acne they have. So if you have mild acne, originally what you start with is either a topical benzoyl peroxide or a topical retinoid, such as adapalene or tretinoin. And then if they're not getting better, you then add the other one that you might not have started with, or you increase the strength. That's very simply put out in this algorithm. If you have moderate acne, you start with a topical retinoid and a benzoyl peroxide, and then essentially if you're not getting better enough, you add an oral antibiotics, or if in females, you can consider doing hormonal therapy. If the patient wants to do the oral antibiotic from the beginning, that's fine, but they should at least be offered when they have moderate acne. And then if you have severe acne, you start with an oral antibiotic and a topical retinoid and a topical benzoyl peroxide, and then you consider whether they need isotretinoin, which is more effective for really severe acne. And hormonal therapy can also be used. This is a kind of general guideline that I've used for a long time, which is just use benzoyl peroxide as a wash or a gel in the morning, use tretinoin at night for mild acne, and then for moderate acne, use both of those and consider doxycycline, and severe acne, use doxycycline, benzoyl peroxide, and tretinoin, and if scarring or worsening, then consider a dermatology referral. And that's all that's said in the past slides also. This is a recent study that was put out from the Lancet, which showed that essentially antibiotics are probably being used too much, and we should really consider not using an antibiotic in the course of acne if it can be helped. And if we do use them, we want to use them for less than three months at a time, and we want to co-prescribe benzoyl peroxide agents because they can help to decrease the chance of resistance. In conclusion, acne is common. It's a huge social problem for children. They really do appreciate if you can make their skin better. Combining topical agents can increase efficacy, but they can be more irritating, so you might want to start with one and then add another one to it. It takes 6 or 8 weeks for acne medication to fully work, and starting with benzoyl peroxides and retinoids is simple and often effective. Of course, you have to look for the safety of the medications and make sure that you're not prescribing them to people in whom they're contraindicated, such as pregnant people. But doxycycline can also be used as an antibiotic on top of topical medicines in order to make it as effective as possible. That concludes this brief snippet about acne and acne therapy and how to make it more effective.